Everyone, welcome. This is Jason Clemmons, Doctor of Chiropractic at the Rock Health and Wellness Center, and this is Life with Jason Clemmons, DC. Thank you guys for listening. It is Wednesday, March the 13th in Lubbock, Texas, and we're right here at the Rock Health and Wellness Center studios and on the radio at 98.7 Walk by Faith and 1420 AM Lubbock Christian Nation. And we hope you have had a fantastic day. We are ready to bring you another good show. Felt like last night we did a pretty good job breaking down movement, talking about some different things with movement, and I want to continue that tonight and keep going with it. I know normally our Wednesday nights is our as our book review night, but I'm still working on a couple of books that I want to bring to us, and I just thought that last night's show was pretty good as far as getting into movement and some of the things that we talked about. So I want to just continue that tonight and carry it forward, and see if we can share some of those ideas for you, so that you understand how important movement is, and because it is massively important. It's important to health, and that's what we're all about. Is we're all about talking about health, and so that's what we're going to do tonight, is continue that to go forward. So our supplement of the day is a combination supplements. And we've talked about this a little bit in the past, but we're going to talk about it again tonight. So our combination supplement are Adrenamin, it's adrenal gland support, and adrenal desiccated, which is also adrenal gland support. Two different supplements that we have that we use here in the office whenever your adrenal glands are getting a little bit exhausted. And so let me read about this for a second, and then I'll kind of explain what that means and why we would use it, right? So Adrenamin contains vitamins that are involved in healthy adrenal gland function and the production of neurotransmitters associated with emotional balance. Involved in healthy adrenal gland functions, supports a healthy immune response to everyday environmental stressors, supports energy production and metabolism, contains vitamins that are involved in the production of neurotransmitters associated with emotional balance, contains a combination of key ingredients that are all standard process products, excellent source of riboflavin and niacin, good source of vitamin B6 and antioxidant vitamin C. And so that's what Adrenamin is. And adrenal desiccated is a lot of the same thing. The adrenal desiccated supports endocrine health. The adrenal glands are important in the body's natural response to stress and energy metabolism, provides powerful short-term adrenal support for immediate energy needs, supports immune system response function during times of increased demand. And so it's bovine adrenal and organic carrot is the proprietary blend with some calcium. So the adrenal desiccated is a little bit different product than what the Adrenamin is. The Adrenamin is, it's got several different vitamins, but calcium lactate, rice bran, bovine liver, bovine adrenal, porcine stomach, natural yeast, organic buckwheat, that's your vitamin C, organic buckwheat flour, bovine adrenal, PMG extract, organic alfalfa, just natural stuff, right? Of animals and plants that we get the Adrenamin. So why would a person need some adrenal support? Well, remember our whole stress response. You guys are stressed out, right? It's Wednesday. Everybody, it's hump day, right? Where do we get the idea that this is hump day? Why do we even talk about something like that, right? Because we're halfway through the week, we're worn out, we can't wait to get till Friday, all that type of thing, right? All those people that live uninspired lives or go to jobs that they don't like, and I know there's a bunch of you out there. Not everybody can be the most spoiled, rotten guy in town. I understand that. I'm sorry that it's my job to be that guy. There's nothing I can do about it. I just ended up being that guy. I get to work on the most amazing system in the universe every single day. It's great, right? But some of you guys don't get to do that. You start looking for the end of the week, right? Because you're kind of dealing with some stress. Maybe you got somebody that's in the hospital. Maybe you got somebody that is not doing well in your family. Maybe you're trying to figure out how you're going to pay the bills. Maybe you're trying to figure out what you're going to do with the kids. All the thousands of things that we can get stressed out about, right? Well, that stress response, remember, fires through on that right side of our brain. It fires down to our adrenal glands, and our adrenal glands are going to release cortisol and aldosterone, like we talked about last week. And cortisol is going to keep our blood sugar regulated, and aldosterone is going to keep our blood pressure regulated by helping us absorb salt, right? And so those two things are happening anytime that stress response gets kicked off. And the stress response gets kicked off from physical, chemical, and mental emotional stressors in our environment. So anytime we have physical stressors, stress is not just mental emotional. Stress is physical, chemical, and mental emotional, all of it together. A lot of times when we think about being stressed, man, I'm stressed out today. We're talking about mental emotional stress, right? And I think we all kind of get that. I think we all get the idea of what stress is all about. And sometimes we run that stress response system for way too long. But we can be chemically stressed. Any of those chemicals, any foreign chemical that's not supposed to be in the body creates a stress response inside the body. And we get into all kinds of chemicals. We get into all kinds of, like, you take Splenda, which is an organochlorine, right? If you put Splenda in your food or you cook with Splenda or all that sort of thing, your body's not supposed to have Splenda in it. Matter of fact, the argument that Splenda is a 0-calorie sweetener is that it doesn't get absorbed into the body. It just passes right through the digestive tract. And therefore, it can't create any calories because you don't ever absorb any of the Splenda, except you actually do absorb some of the Splenda, and it attacks your thymus gland, and it causes immune system function dysregulation. And now you've got a chemical stress inside the body, right? It's just one thing. And you can start thinking about it. The toothpaste, the deodorant, the hairsprays, the things that we cook with, the things that are in our carpets, all those chemical stresses can stress us out. And then there could be physical stresses that we do sometimes, that the way we sit in a chair for 14 hours in a day, or the way that we don't get enough sleep properly because our bed is not proper, or it's too soft or it's too hard, or any of those things, that we have physically. We don't exercise, we have to carry too much weight, all those things that happen, right? And so sometimes you get run down. And when you get run down, you need a little bit of support. And one of the ways that we ask here in the office about Drenamin and adrenal desiccated is we ask you, how's your sleep? That's one of the things that I ask. And if a person says to me, man, I can't get to sleep, it takes me forever to get to sleep, that's where we use Drenamin. Drenamin is adrenal support in that regard. That's one regard. There's multiple reasons we could use it, but that's one way that we use Drenamin, is if you can't get to sleep. The other one is if you can get to sleep, but you can't stay asleep. You get to sleep, but then you wake up multiple times throughout the night and you can't stay asleep. That's where we come in with the adrenal desiccated, and we use that in our office to try to help you get through the night, to try to support. Those are kind of indicators for us. We have other indicators as well, and the some of those things we've done several different heart rate variabilities this week, and we've seen some results that you kind of catch those things before they're happening, and like way before they're happening. And I've shown you this before, but I wanted to show it to you again. We've got our plus sign in the middle of our screen, and the plus sign represents the sympathetic nervous system that goes up and down. So we've got the sympathetic nervous system that is on the vertical line, and we've got the parasympathetic nervous system on the horizontal line. And so what I'm talking about tonight, especially talking about Drenamin, is I'm talking about what happens to a person when they get in the wrong quadrant. And so remember, where we want you to be is we want you to start right there in that quadrant. We want you to be +1 These are positives going up and then positive to the right. So we want you to be +1 in your parasympathetic, 1 over to the right, and then 1 up in your sympathetics. So that means that you're chill, you're calm, and as my daughter just told me, that's mindset. She came, got adjusted, and right before I was going to come on the show, and I was like, "Hey, hurry up!" And she's like, "Chill," and I was like, "I don't have time to chill. I got to get ready for a show." And she's like, "It's a mindset," and I was like, "Oh, really? Why don't you hurry up and get adjusted?" And so, what she has been getting adjusted since she was 9 days old, by the way, and she's 23 now. So, but we want your parasympathetic to be turned up just a little, and we want your sympathetics to be able to respond. So if you were to get in a fight or flight response, remember that's what that is. That's fight or flight. And if you were to get in that fight or flight response, you need to be ready to respond. And so what we found is sometimes we find people that are down here on this line, like whenever they start there with their heart rate variability, they're over here in this area. And then, or they may be down here in this area. And what is that telling me? That's telling me from a sympathetic stress, from a sympathetic nervous system evaluation standpoint, this person is not turned up at all. And how do they respond when we ask them to move? When we set them up, how do they respond? And do they respond at all? Some people don't. Some people just stay. They're right there, and they don't get any sympathetic or parasympathetic. Like the whole thing is just neutral. So the other way we could check that is with the pulse ox, and we do this with all our new patients, and just put that, we just put that on someone, put that pulse ox on them, and we just test what their heart rate is. And so right now my oxygen's 98, my heart rate is 72. So it's just sitting there at 72, dropping to 71. There's 70. It'll probably drop into the 60s. But what we expect to see whenever I stand up, so it's 70 right now. So now I'm going to stand up, and what am I going to get? Well, now it's 75, 77, 78, 79. And now we're dropping back down to 78 to 76 to 75. So we went from 70 to 79 when I stood up. Because when I stand up, what I should get is I should get a sympathetic response. Standing up should make my sympathetic response increase because blood flow comes out of my head. And when blood flow comes out of my head, my brain doesn't like that. And so I should get an increase in my sympathetics whenever I stand up. And what if you don't? What if you stand up? What if your heart rate is 70 beats per minute, 72 beats per minute? That's the average. What if your heart rate is 72 beats per minute and then you stand up and it stays at 72? It doesn't respond. What should that tell us? Well, what that should tell us is that your sympathetic nervous system may be dampened. It may be downregulated. It may not be responding properly when your body is functioning. So what could happen to a person that their heart rate doesn't increase whenever they stand up? Well, one of the things that could happen is they could pass out because the reason that you get that sympathetic response is to push that blood back up into your head, right? And if you lose the blood in your head, like if your blood pressure drops or you have vasovagal syncope and any of those things that happen that makes your blood pressure drop, you guys know that you pass out when you get a shot, something like that. Bam! All of a sudden, why do you pass out? Pass out because you lost your blood pressure and you don't have enough oxygen in your brain, and your brain wants you flat on the ground as quickly as possible. So the brain's going to pass you out. It's going to make you pass out so it can get flat so that the blood can flow back into the brain, right? Those are things that can happen. Well, if you're not getting any response from your heart rate when you stand up, that might be an indicator that your sympathetic nervous system isn't firing properly. Your adrenal glands have become fatigued. that's a problem. It's a problem in the middle of the night whenever you can't control your blood sugar. You can't, if you don't have enough cortisol, if you're not keeping your blood sugar, you can become hypoglycemic. If you're not getting enough food, if you're not having that stress response, you may not be able to control your blood pressure. Your blood pressure may be getting low, and those things are not good. Neither one of them are good, to not be able to control those things. So that's what our supplement of the day is all about. Drenamine for you. And then the other thing is adrenal desiccated. Both of those things have worked really, really well for people who need some adrenal gland support. You can get all kinds of adrenal gland support out there. This is what we have in the office that we use with Standard Process. And if you want to get some Standard Process from us, you can get it here at the office, or you can go to therock.standardprocess.com. therock.standardprocess.com, and you can get it yourself and order it for yourself if you want to. And that's the way that we would dose it. But I'd be glad to talk to you. I highly recommend you give me a call if that's what you're going to do. But you do have that option. One more thing before we get into the movement stuff is I wanted to just mention one more time that we do have a scanning technology here in the office that can build a custom orthotic for you. And I wear these almost every day. I really enjoy them. They're very comfortable. They get my feet proper inside my shoe, and I really do enjoy these. They're having a special on them right now for the month of March. You can get a pair of these for $199. These are custom orthotics. They're guaranteed for a year at least. They have a great company. They do a great job. This one especially is one of the best ones. They've got smaller ones for your dress shoes. If you need them for dress shoes, something like that, they've got them for marathon runners. They've got them for tough oil field workers, guys that work out in the fields that need a tough leather. They've got that for you if you need them. But they're having a special on them, and it goes back to, remember last night when I talked about the lady that couldn't feel her feet, and her feet had so much input, and we talked about that last night, about the input and how important input from the foot is into the brain so that the brain functions the way it's supposed to. It's vitally important for you to get that input. So it's vitally important the way your foot functions. And if you're interested, we got that. They're having Foot Levelers is actually having a special that you can get that, and we can order you something. We can scan your feet. We can get you a custom built orthotic, and it's pretty good stuff. So you can get two pair for $269. So no, $299. Two pair for $299. One pair for $199. If you're interested in that. So that's all I have to say about those two subjects. So let's get into movement, and let's continue our conversation that we were having last night about movement. And let's go back to the articles that we were looking at. And again, I can't print these off, so you guys on social media, I'm going to have to look at this screen while we're going through this. But the article that we were talking about last night, let me see if I can actually I'll just bring it up for us right here. See if I can get this pulled up right quick. Yeah, and you may be able to see this. Let me see how clear this comes through, because you may be able to catch this on Facebook or YouTube. Oh, that's another thing I meant to. I forgot. I was going to mention it tonight, and let me mention it before we get any further along. So last night I talked about bananas. That study that was done that talked about how bananas can interfere with the polyphenols, especially the flavin-3-ol that is in your berries, that is antioxidant rich, that helps you with your cardiovascular system and so many other things that you want when you eat your blueberries and your strawberries, and how mixing bananas with them will sometimes increase the polyphenol oxidase, which breaks down the polyphenols, which now is like an 84% reduction in that particular polyphenol, the flavin 3-ol. That we talked about that last night with bananas. If you add bananas to your smoothies, you're running the risk of destroying the good polyphenols that you're trying to get from your blueberries and your strawberries when you mix a banana in there. But MJ from Roswell sent me a note last night. He did it. He sent it to me on YouTube, and I couldn't see it until I didn't get it until after the show was over. MJ's my MJ Lewis, Doctor of Chiropractic at Rock Health and Wellness at Rock Chiropractic in Roswell, New Mexico. Super fantastic dude, super smart. Love him to death. He and Katia, you guys know that. But Dr. MJ sent me a message last night and told me, he said, hey, green bananas don't do that. And according to Dr. Gundry, who is one of the guys that talks a bunch about this stuff. But so, yeah, a green banana doesn't have the polyphenol oxidase that's ready. And so if you want to mix a banana in your smoothie, now it doesn't talk about the sugar content of the banana. It doesn't talk about that if you're trying to control your insulin levels and all that sort of thing. And there's some information that says the banana in the smoothie is going to increase your insulin levels. But if you're not concerned about that, then a green banana mixed in your smoothie doesn't destroy your polyphenols from your blueberries and your strawberries. Just wanted to share that piece of information with you. Thank you, MJ, for sending that last night. I sent him a message last night when I got home, told him thanks for sending that information. But it's good stuff to know if you're interested in it. The green bananas apparently are way better to eat than a ripe. A ripe banana is really not good for you. It has the polyphenol oxidase, and it has a high sugar count. So you'll increase your insulin with that. And what do we do with ripe bananas? We make banana bread. Yeah, that's what we do. We make banana bread. The cooking kills the oxidase, so you don't have to worry about that. So, but that's not a problem because you're not eating banana bread because you're trying to get a lot of healthy foods in you, right? You just didn't want to waste the bananas, and so you made bread out of them. And I'm guessing there's probably some sugar in the banana bread. I don't really know how you make banana bread, but any of you guys out there that know it, if you want to send me a recipe of banana bread, we'll talk about the contents of the banana bread. I'm sure there's some flour and some sugar and some stuff in there that might go along with it, but that's typically what we do when our bananas get too ripe, right? Can't throw those bananas away. We got to make a bread out of them. We got to make something else. We got to make us a dessert. So that's what we'll do. Yeah, it probably doesn't fit in the health and wellness category. But okay, enough of that. That reminded me of that last night, so I just wanted to talk about it. But let's talk about this article that we were talking about. I'll just talk about the end of it, and then we'll move along to the next article, if I can find my mouse. Yeah. Where is it? That one's not it. I got so many articles pulled up right now. Let me see if I can find it. Hang on. Here we go. Yeah. So experimental models of osteoarthritis, the role of immobilization, Clinical Biomechanics, November 1987. This is the article that we were going over last night, right here. I'm not going to go through the whole thing. Just it talked about immobilization for whatever reason is one of the pathogenic factors in musculoskeletal degeneration. That's a key point right there. It's one of the factors in degeneration of the joints, right? When they don't move. Joints that don't move wear out. Joints that don't move degenerate. That's what the science is trying to tell us. People say, Doc, can I get adjusted too often? Physical therapists sometimes will throw stones at chiropractors and say you're creating hypermobility in the joint. It's adjusting a joint every single day is a bad thing. Well, you ever seen a cat? every single day. Every single day when a cat's laying down and it gets up, it does this little stretching thing, gets all of its joints moving. You ever seen horses do that sort of thing? Stretch out, try to get their joints moving? Yes, there's no such thing of getting adjusted too often. I don't believe that at all. Now, there's some neurology that goes along with it. We don't always want to fire those pathways in certain manners, but moving joints that are moving properly through proper ranges of motion don't wear out. Okay? It's the joints that don't move that wear out. Immobilization is one of the pathogenic factors in musculoskeletal degeneration. That is that's factual right there. Okay? And experimental studies show that after 2 weeks of immobilization, X-ray changes are seen, including joint space narrowing, subchondral sclerosis, and osteophyte formation. And what I wanted to say down here at the bottom, rhetorically, is a subluxation a form of immobilization? If yes, then the lack of mobility of the subluxation joints, hang on, the lack of mobility of the subluxated joints initiates periarticular soft tissue shrinkage, periarticular fibrosis, and joint cartilage degeneration. Yes, subluxation, lack of movement in your spine and your joints can cause degeneration. We're going to take a break. We'll be right back right after these messages, and we'll be talking about movement on the other side of the break. Yeah, in chiropractic, that's what we said from day one on this show. You get adjusted because you're subluxated. You have interference in your nervous system. Well, subluxation, one of the things that we measure, how we measure subluxation, is immobility. The joints are not moving properly through the proper ranges of motion. And they can cause problems with the disc. They can cause problems with the ligaments that are around the joint. They can cause problems with the muscles that run over the top of the joint. They can cause problems with the nerve supply around the joint. Everybody that's ever had a bulging disc in their low back understands that, right? You understand that if you have a bulging disc, how'd you get a bulging disc? There's only really two ways you got a bulging disc. Number one, you had an extreme acute trauma. So someone pushed you off of a roof and you landed hard on your feet and bam, all of a sudden you got a bulging disc. That's one way. The other way is you had abnormal movement over time, over and over, repetitive, over and over. You had bad posture. You had bad neurology. Your body wasn't moving properly. And then you decided this weekend you were going to work in the yard, and then you were just going to rake up all the leaves, and then you were going to take the leaf trash can, and you were just going to dump it in the dumpster. And when you picked up that leaf trash can, you had yourself into flexion, and that joint wasn't moving properly, and you bulged that disc, right? That joint wasn't moving properly is the point I'm trying to make. And immobilization is part of the scale of not moving properly. So just wanted to make sure that we talked about that one more time, and then I want to get into a couple of these other things. So okay, everybody, we're back. This is Jason Clemmons. This is Life with Jason Clemmons, DC, and we're talking about the importance of movement, how important it is that we get movement, and that we are handling things properly in movement. So there's another article right here in Clinical Orthopedics and Related Research, Normal Ligament Properties and Ligament Healing. And so one of the things about I just wanted to talk about is that how ligaments are, because we're talking about movement. And what is a ligament? A ligament is a tissue that holds a bone to a bone. That's what a ligament is. So you've heard of like tearing your anterior cruciate ligament in your knee, your ACL. You've heard of that before, where a person tears up their knee and they tear that. What is the ACL? It's a ligament in the knee that connects the femur, your thigh bone, to your tibia, which is your shin bone. And that ligament needs to be the joint needs to be moving properly because the ligaments are so important. So ligaments clearly serve adjunctive roles to muscle tendon units, proprioceptive feedback to joints by both intrinsic and extrinsic nerve stimulation. That's important right there. Ligaments, and this is from Clinical Orthopedics and Related Research, June of 1985. This muscle tendon unit, proprioceptive feedback to joints by both intrinsic and extrinsic nerve stimulation. So we've got nervous system involved. So now we've got nervous system involved in every single joint of the body. Every joint in your hand, your fingers, every joint, your wrist, all of your hand and your wrist, your elbow, your shoulder, your brain, your skull, your cervical spine, your thoracic spine, your lumbar spine, your sacrum, your pelvis, your femur, your tibia, and your knee, your ankle, your entire body, your TMJ, all of it. You got ligaments all the way, and this neurofeedback probably plays an important role in joint development and growth as well. Ligaments may serve as facilitators of immune defense. I mean, how about that? That's a big deal right there. How many of you thought about that? Your ligaments have something to do with your immune response. Ligaments may be even more crucial or critical in normal joint function than we can currently appreciate. A scar formation after ligament injury slowly remodels and approaches, but never equals highly organized appearance of normal ligaments. So movement after scarring is decreased. Vitally important to understand. Movement after scarring is decreased. So if you have a tear of a ligament, you have a scar of the ligament, then what you're going to get is you're going to get a decreased range of motion. Well, what happens when you have a whiplash type situation and you go in there and your head goes back and forth? What is it? Well, we get that sprain strain, right, of the muscles, the tendons, the ligaments in our neck. And we get that when that happens to us, then we're going to create micro trauma to that joint, and that micro trauma to that joint is going to create a scar tissue that's going to crisscross itself in a healing pattern, and the scar tissue is going to decrease your range of motion. And the decrease of range of motion is going to decrease neurological input into your brain. And the decreased input is going to catch up to you over time with decreased output. Right? It's so important. The scar may ultimately stretch out again, however, as the ligament is repeatedly stressed. Sounds like the goal of spinal adjusting. Yes, they were trying to get those joints to move. We're trying to get those joints to move through their proper range of motion so that they will go back and stretch. One of the longest ligaments that you have is the anterior longitudinal ligament that's on the front of each of your vertebrae that goes all the way from C2 down to your sacrum. And that anterior longitudinal ligament will shorten over time, which will actually change your cervical curve. That's why we do circular tractioning in the office, so that you can make sure that you're getting movement again. That's what I just wanted to show you with this particular one of this article. So that's just one of them that I wanted to point out to you tonight. And let me see if I can. I got so many of them going on right now. I tried to print these out and they didn't print out. I wanted to get back to this one that we talked about last night with the adolescents and the joint pain and the back pain. And I'm not a back pain guy. Let me see if that was it. No, hang on. I know you guys on the radio are like, what is he doing? But I'm trying to get my article pulled up so that maybe you can see it. There it is. So maybe it makes a little bit more sense as we're going through it. But spinal manipulation and exercise for low for low back pain in adolescents, a random trial. This is the one we started to talk about last night, and then I got a little sidetracked about it. But this is talking about, they used 185. This comes from the journal Pain, March 27, 2018. The study was used in 185 adolescents aged 12 to 18 years old with chronic low back pain. And chronic low back pain was defined as having a duration of the current episode of greater than 12 weeks. 96% of the study subjects had low back pain that was chronic in nature. Consequently, the results of this study are more applicable to adolescents with low back pain that is long-standing. Yeah, well, it's long-standing. I mean, that's not good. That's not a good thing. Like, kids aren't supposed to have low back pain, and it's not supposed to be lasting. We shouldn't have chronic low back pain. That's a bad deal, right? Something went on, and that should really be checked out. And kids, they respond so quickly to chiropractic care that that's something that is vitally important right there. So the exercise therapy consisted of 8 to 16 45-minute sessions with an exercise therapist followed by home exercise. The spinal manipulation consisted of 8 to 16 visits with experienced licensed chiropractors no more than 2 times per week. So you're talking about 2 times a week for 4 weeks or for 8 weeks of getting them adjusted. It talks about it, and it talks about the primary outcomes, the secondary outcomes, and this is the first adequate powered randomized trial to evaluate the effectiveness of promising non-pharmacological interventions for adolescents with low back pain. And so it talks about the prevalence of it in the United States in the midst of an unprecedented pain management crisis, the chronic pain impacting over 1/3 of the U.S. population and affecting more individuals than heart disease, diabetes, and cancer combined. Low back pain is one of the most common and burdensome of the pain conditions, with an estimated 40 to 80% of individuals worldwide experiencing low back pain at some point in their life. And I'm not a low back pain guy. I'm not telling you this for this reason. I just wanted you to know it, and I wanted you to know that getting adolescents adjusted is a thing that happens out there, and it's a great thing to get that person to function properly. Low back pain related disability has increased an alarming 42% over the past 2 decades, making it the leading cause of disability globally. Now, this was in 2018, and it's increased 42% over the last 2 decades. Well, part of the reason it's increased 42% is because we've invented cell phones, and kids aren't active and getting out there and running and playing. If they would get out and run and play and be active and get their eyes up and get their brains functioning, then that would be they would eliminate a lot of that, because low back pain is secondary to brain function. I'm going to say it. I'm going to just keep saying it until you really get it. Low back pain is secondary to brain function. So while there has been long-standing belief that low back pain is limited to adults, there now is substantial evidence on the contrary. In fact, research has shown that low back pain develops with increased frequency in adolescents, with prevalence rates reaching that of adults by the late teens. 20 to 40% of U.S. adolescent low back sufferers receive an opioid prescription when they seek medical care. That is crazy. And Dr. Murphy said this in his article right here. 20 to 40% of U.S. adolescents receive an opioid prescription when they seek medical care. Why is that? Because when the medical doctor sees the patient, and the medical doctor is going to go look in their toolbox to see what can I do to help the patient with this problem, what is in the toolbox? You guys know the answer to that question. And I'm not throwing shade at medical doctors. I'm just saying, what is in the toolbox? When they go to help somebody with low back pain, what are they going to use? They're going to use adjustments? Not a chance. Maybe a DO might. Not a rare case. Is that going to happen? No, that's not going to happen. Well, they're going to use drugs or surgery or physical therapy. That's what they're going to use. And you came to see them, so they might as well give you a drug. And they don't care if you're 12-year-old or 13-year-old or 15-year-old. They don't care if they're young. They're just going to give them a drug anyway. And it's like, that's crazy, right? There is a heightened urgency to identify safe and effective non-pharmacological low back pain treatments for all ages. Spinal manipulation therapy, adjustments is what we call them, is the most common provided based complementary approach and is often used to treat low back complaints. There's my favorite word, one of my favorite words again, right? Spinal manipulation therapy is the most common provider-based complementary approach and is often used to treat low back pain complaints. It's not complementary in the wellness world. It's not complementary to anything. It is the treatment, right? And so it talks about it. So let's get into results. The longitudinal omnibus test for pain showed to be significantly superior to exercise therapy over a 1 year period. The spinal manipulation therapy plus exercise was significantly superior to exercise alone. Spinal manipulation group experienced significantly greater changes in the long-term profile of pain severity. Longitudinal profiles significantly favored adjustments and exercise for disability, improvement, and satisfaction over a long term. Patient-related satisfaction with treatment showed a statistically significant advantage for the adjustment and exercise group at all time points. So both groups alone, both the adjustment and exercise alone groups reported approximately 80% reduction in medication used at the end of the treatment, which was substantial during the entire follow-up period. These are important findings in light of growing concerns regarding safety and effectiveness of pharmacological treatments for managing pain. It's super important. You can take your child and get your child adjusted with some exercises, and they're going to be way better off than if you get your child an opioid pharmaceutical, right? Side effects. The most commonly reported adverse events were unusual or increased soreness and different types of pain. Side effects were similar in both groups, mild and limiting. There were no serious treatment-related adverse events. Important. There were no serious treatment-related adverse events with getting adjusted. And it's all you got to do is check the rolls on malpractice insurance. Go ask any chiropractor anywhere in the United States how much they pay for malpractice insurance, and then go ask your pediatrician or your medical doctor how much they pay for malpractice insurance. And it's not even close in the ballpark. It's not even close to the amount of money the medical doctor pays in malpractice insurance, right? So they're way higher. The chiropractors are way lower because the chiropractors are not dangerous, and the drugs that the medical doctors use are dangerous. That's why they're higher. For adolescents with chronic low back pain, spinal manipulation combined with exercise was more effective than exercise alone over a 1 year period, with the largest differences occurring at 6 months. That's important. With sufficient power and use of standard recommended outcome measures, our study demonstrates that adjustments with exercise provides potentially worthwhile long-term benefits for adolescents with low back pain that is chronic in nature. One of the things that is super important right here to understand is that part of the problem is that we're expecting a quick fix. We want it to be solved immediately. So we'll go to the medical doctor to get some sort of opioid drug that's going to fix the pain immediately. But in the long term, those people aren't better off than because they didn't get to the root cause. And when you get to the root cause of the problem and you start to work on it, sometimes it takes a little bit more time. It may take 4 to 8 weeks of getting adjusted twice a week. And it might be a tad bit more expensive in the short run, but if you look at it in the long term, it's not. It's not more expensive. And because it creates more of a stable base, you solve the problem, you get the brain to fire properly, you reestablish the neurology, you get the muscle tone reestablished the way it's supposed to, you clear out the faults, you remove the subluxations. There's a lot to it. What I get a lot of times is I get parents who they have a child that's hurt themselves in some form or fashion. They've got some low back pain. This one is chronic. This is longer than 12 visits. And the way they will end up doing is it's like 1 or 2 visits. They want 1 or 2 visits, and then they expect that whole thing to be resolved, and that we should just go back to doing what we were doing. And that's not how it works from a health standpoint. You might get lucky and get adjusted once or twice. It might not be that severe. It might not be chronic. It might not be. And chronic was, it was defined as being over 12 weeks. So, but there was some sort of issue that went on for 12 weeks. It's not unrealistic to say that this might take 8 to 12 visits, 8 to 16, as they said in the study, to get your child back to functioning the way they're supposed to. So, and the same thing happens with adults, really. When, like I had a guy today that hurt his back on Saturday, and he was full blown bulging disc, like hot low back, couldn't hardly move, couldn't sit down, was in severe pain, just completely in contraction. Like glutes were in contraction, psoas was in contraction. He was guarded, super guarded, and I worked on him for about 30 minutes to try to get him to calm down just a little bit, and then we sent him home tonight with some anti-inflammatories and some muscle relaxers. Yeah, not the way your medical doctor does it, not the way you get them if you go to the emergency room. Your anti-inflammatories were your fish oil and your turmeric, and the combination of that, and the muscle relaxers was the magnesium. So that is what we talked about. And then we talked about a little bit of heat. We talked about some home things that he could do. We talked about some posture things that he could do, and to try to get that to calm down. And then we plan on seeing him tomorrow or Friday. And so it's not a quick fix when you're working on it. You could go get a shot sometimes, and the shot, if you go get a shot, then it's like, okay, sometimes that's a way. You can dull the pain quickly, but you didn't solve the problem if you do it quickly. So wanted to point that out right there. Overall, a supervised exercise program with additional of spinal manipulation appears to be promising treatment approach for chronic low back pain. Yes. All right. So that is the end of that one. So let's get over here to this one. When we talked about this one just a touch last night, but I want to finish it. And there's one more. No, let's talk about this one. Theoretical basis for maintenance spinal manipulative therapy for the chiropractic profession. This was in the Journal of Chiropractic Humanities, December 2011. And this is more of a philosophical conversation with some things mixed in. But the purpose of the article, let me pull it up for you. Purpose of the article was to discuss a theoretical basis for wellness chiropractic manipulative therapy. A search of PubMed and other manual, alternative, and natural therapy index systems was performed with a combination of keywords: chiropractic maintenance and wellness care, maintenance manipulation, preventative spinal manipulation, hypomobility, immobility, adhesions, joint degeneration, and neuronal degeneration. So they did some searches. The search revealed surveys of doctors and patients, an initial clinic pilot study, randomized controlled trials, and laboratory studies that provided correlative information to provide a framework for development of hypotheses for the basis of maintenance spinal manipulative therapy, which I personally think is a complete hogwash statement. But I'm going to keep going, right? Maintenance care optimizes the level of function and provides a process of achieving the best possible health. It is proposed that this may be accomplished by including chiropractic manipulative therapy in addition to exercise therapy, diet, nutritional counseling, and lifestyle coaching. It is hypothesized that because of spinal manipulative therapy, bringing a joint to the end of its paraphysiological joint space to encourage normal range of motion, routine manipulation of asymptomatic patients may retard the progression of joint degeneration. Now, we just covered that, right? We just covered that right there. It's not, I mean, I guess to totally protect yourself, you can say it is proposed that this may be accomplished by including chiropractic. No, it is hypothesized that because spinal manipulative therapy brings a joint to the end of the paraphysiological joint space to encourage normal range of motion, that's where you get the osseous adjustment, you get the movement, the pop that you like so much. Routine manipulation of asymptomatic patients may retard the progression of joint degeneration, neurological changes, changes in muscular strength, and recruitment patterns, which may result in improved function, decreased episodes of injury, and improved sense of well-being. I have a, based on the science, I think there's a transition that needs to take place in my profession so that you understand it. An asymptomatic patient. So if I go get my blood work done like I did 2 weeks ago, and my A1C is 8, and I don't have any symptoms, am I a maintenance patient or not as far as the medical world is concerned? If I have an A1C of 12, but I don't have any symptoms, would I be considered a maintenance patient? Not in one doctor's office anywhere in the United States of America would that person be considered a maintenance patient. That person, an asymptomatic person with an A1C of 12, would be considered a high-risk patient that needs medical intervention in every single doctor's office anywhere in the United States, probably in the world, right? How about if I went and got my blood pressure checked? I'm asymptomatic, but my blood pressure is 160 over 95, but I don't have any symptoms whatsoever, right? Then I would be considered a maintenance person, not in one single place anywhere in the United States. My doctor would be trying to get me on blood pressure medication immediately if my blood pressure was that high, right? But for some reason, and this is not to the patient, and this is not to you guys that are listening that are patients, it might be to some chiropractor out there that, but for some reason in my profession, we have believed, and we still believe, of this ridiculous notion of maintenance care. Actually, when COVID hit, I got a letter from the State Board of Chiropractic, the Texas Board of Chiropractic Examiners, that said that we will do only necessary adjustments, no maintenance adjustments. And it's like, I don't even understand really what that means. Getting adjusted when you're asymptomatic is not addressing your pain scale, obviously, because you don't have any pain. But it is addressing the multiple other reasons that you need chiropractic care. It's addressing those things that are going on neurologically. It's addressing immobilization that you might have of joints that aren't moving properly, that we have studies from reputable publications that tell us that that's pathological, that immobilization is pathological, right? So when we talk about it, it doesn't make any sense to me, but it is, what we do talk about is that wellness or maintenance care may not be defined as being medically necessary for a current condition. However, this type of care optimizes the level of function and provides a process of achieving the best possible function of health. This care includes chiropractic manipulation. Yes, if you look for functional improvement, which may use measurement outcomes to show functional improvement, which may qualify such care as being medically necessary. Exactly. If you look hard enough, if you have the technology to look hard enough, then you'll find that person is not functioning properly. And if they are functioning properly, they don't need an adjustment at all. I've run out of time. So that is the end of our show. I apologize for running out of time. We will continue this conversation tomorrow night at 6. I hope you guys have a fantastic evening, and we will see you tomorrow. If you got any questions, just send us a text or make a comment, and I will get back to you.